So if we look at historical data, what we realize is that the incidence of colon cancer begins to rise more significantly by the time you reach age 40. And in fact, by the time you get to 50, it's significantly higher. So if you're looking at the process of trying to detect the precursors to colon cancer, the polyps for colon cancer, that's our target population. We want to begin screening people for these polyps before they have a chance of becoming cancer by doing these tests.
Age 40 or age 50?
Yeah, so actually we'll split the difference. It's 45 now. That recommendation was made as recently as just this past year. And that was based again on the observation that for many years when we were screening people starting at age 50, that we were missing a part of the population between 45 and 50 that had almost identical colon cancer incidence as the ones over 50.
So it doesn't mean everybody can wait till 45. Who needs it sooner?
Yeah, anyone with a family history needs to begin thinking about it somewhat sooner. And the age at which your family member or members developed colon cancer, or for that matter advanced colon polyps, is really what dictates when an individual should start screening themselves.
Give me an example.
So if someone has, let's say, a parent who is in their mid-50s or perhaps 60 years old, then that person should start at age 40. That's pretty much a baseline value to start. If someone had the misfortune of having a family member that was diagnosed with colon cancer at a much earlier age, let's say 42, then that person actually should start 10 years before their family member. So in their early 30s is when that person would start. For the most part, it's age 40, 45, 50, that range, and then certainly after 50, it begins to rise even further. Do we see colon cancer in 30-something-year-olds? We do actually, but almost always in the setting of a very strong genetic syndrome. So either an individual who has multiple family members that have had polyps or cancer, or for that matter, a known genetic syndrome that increases the risk for colon cancer and polyps in that person's entire family tree.